Hello, everyone. Hope you all are doing well. Welcome to this webinar. I am Bhawana, Director of Marketing Partnerships at RehabPath India. We are a Madison-based startup with the mission to help patients and families struggling with addiction and mental well-being by connecting them to right treatment centers. We work with around 2,000 plus centers in India, and in today's webinar, we will be discussing understanding emotions, a patient's journey through addiction and rehab with Sanctum Wellness. And our guest speakers are Dr. Danish Hussain and Dr. Niharika Singh. Both are psychiatrists from Sanctum Wellness. Rajnandini, who is a psychologist and is also a part of our team, she'll be driving rest of our conversation today. This is going to be about an hour session, and feel free to drop your questions anytime on FB or Zoom. We will take them at the end of the session. Over to you, Rajnandini.
Thank you, Bhavna. First of all, welcome again, Dr. Danish and Dr. Niharika. I'm so excited to have you here with us.
Thank you so much. Thank you.
Yeah. So before we go into our main topic, first, can you give our audience a little bit of introduction about yourself?
So I'm Dr. Danish. I am a psychiatrist. I've done my psychiatry, my MD in psychiatry from Bangalore, and I'm also the director of Sanctum Wellness and Healing. So we've been doing this for more than 5 years now since Sanctum is running, and overall we've been doing this for more than a decade now, around a decade. Yeah.
Dr. Niharika.
So I'd like to start off by saying thank you for the opportunity, and it's lovely being a part of this webinar. And it's lovely to be a part of the process where we're providing information to patients out there and their loved ones, pertaining to the topic that we have today. And a little bit about myself. I'm Dr. Niharika Singh, and I'm a consultant psychiatrist with practice in psychiatry for more than about 10 years, similarly to Dr. Danish, as he's mentioned, starting off with MBBS and then MD Psychiatry in Bangalore, and following which, of course, to enhance oneself, we need to be in touch with whatever is latest in terms of psychiatry worldwide. So I've been a part of multiple fellowships and courses the world over, from America to here in India as well, be it NIMHANS, be it Duke University, Harvard, and following which, of course, there's been a lot of government sector practice as well as private practice, and been a part of Sanctum's journey right from its beginning. And I've been associated here and been working intensively for the past 5 years. And it's lovely to be a part of Sanctum Wellness and Healing here in Delhi. So that's about me. Thank you.
Thank you so much. It clearly looks like you have a very varied and rich experience. So I'm very excited to go forward with this conversation. Since you're both from Sanctum, could you tell us a little bit more about how Sanctum was started and what all services you provide over there?
Okay. Well, we felt before we started the facility, we felt that there was a dearth of quality centers that cater to rehabilitation or any other kind of psychological issues. Mostly in the past, we saw people getting tortured or beaten up in facilities which were not up to the mark. So as psychiatrists, we thought that this would be the right time for us to then take over the field. So that was the reason why we decided to start Sanctum, so that we can provide the best possible help to the patients here with the best possible facilities that we can provide for them as well. So the environment has to be a certain way. They have to feel comfortable. They shouldn't feel like they've been locked up in a prison. And at the same time, we can then go ahead and have a much better therapeutic interventions designed for them and each individual. We also decided that we're not going to take a lot of clients. We're not going to take a lot of patients. We're going to have a very limited number of people. We're going to focus a lot more on the quality. Then we're going to focus on the quantity. So that's the reason why we don't take a lot of clients as well. Thankfully, I think, if I say so myself, I think we've been very lucky that we've been able to help a lot of patients over the last 5 years now, half decade of our life here at Sanctum.
Is there anything that you'd like to add, Dr. Niharika?
Yes, I do agree with Dr. Danish completely that having practiced elsewhere, especially when it comes to addiction psychiatry, I think we've, as a part of the Indian society, we felt that there is a lot that's lacking in terms of just how stigmatized this particular field has been, and how, various places would be approaching it, unfortunately. And there was a huge requirement, there was a void where, we can deal with this with dignity when it comes to our patients and their family members. And uh, when it comes to treatment centers the world over, I think, having had exposure to that as well, we thought that, this would be a great way of having an East meets West kind of a center where we have best practices of both parts of the world, and where we take only 10 patients at any given point in time. We have an extremely customized program here, with a therapist to patient ratio being 1:1. So we intensively, deal with therapy, and as well as, customizing it, personalizing it, including the family, making them a critical part of the process. And most importantly, it's completely voluntary. And that's what I think sets it apart. It's comfortable. It's just like home. But yes, of course, we're providing refinement, improvement, and a sense of dignity to our patients. So yeah, that's about Sanctum.
Okay. That's really nice to know. And mental health has come a very long way, like in our history. Especially addiction has a lot of stigma attached to it, and there are, because of it, a lot of misconceptions around it. And it's necessary for more centers like this to come up and provide the right kind of guidance and approach to clients, to patients, and their families as well. So I'm really glad that you're doing this, and I hope that you keep doing this in the future and that you grow. So today we are talking about the emotional journey of a patient going through addiction, as a lot of us might have seen maybe within our families or with some of our friends who struggle with addiction, how emotionally draining the journey can be. And there's a lot of ups and downs involved. So let's get into that. And first, I would like to ask you, what is the most difficult part, emotionally, the most difficult part in a patient's journey to recovery?
I think emotionally the most difficult part would be when they decide that there is something that they want to, they want help. Once that insight sets in, and that's when there's a lot of emotional dysregulation, they start having a lot of fluctuations in their emotions. There's a part of them that decides to do something about it, then there's a part of them that decides not to do something about it. So that fluctuation in the emotions initially before they joined is very tricky. It's very hard for them to make that decision in the first place. And when they do, finally, gradually over a period of time, they start feeling much more steady and much more comfortable. But then there is some level of dysregulation, and it varies from sadness to frustrations to anger to irritability. So the initial part before they make that decision, and once they come initial few days, you will see a lot of those fluctuations that are there. Mostly anxiety is very common. Your sadness of mood tends to be there. The emotions get a little, they feel a little low, irritated, irritable initially. So that is very hard for them to, you know, overcome initially. Once they do, we find them then settling in nicely, and then gradually they start to be much, much better.
Okay, that's a little like unexpected to hear. Like you would expect that, maybe the after journey where you're trying to maintain your abstinence would be difficult, but
Yeah.
it's true that the hardest part is to be able to acknowledge that there is a problem.
Yes. So see, I mean, there is going to be the whole journey, and in my experience, in our experience, if I can say that we have recognized that there is a lot of emotional dysregulations in the initial part of it. Then it settles down. Then there are a lot of other things that happen, later on. before discharge, we have seen, or even after discharge, we have seen people sometimes have pink clouds. They're extremely excited. They're very enthusiastic. They feel like they can go outside and do whatever they want. They have absolutely beaten the illness. And sometimes we see them, they're experiencing pause, like, the post-acute withdrawal syndromes, where they feel absolute dip in the mood and the emotions. They're not able to feel much, and they feel that, okay, we don't know what to do about this. And they sometimes feel that they might never be able to come out of it. Uh, but over a period of time, it steadies and it stabilizes. So there is oftentimes this initial part, then there is after they get discharged. In the middle, we see them stabilizing to some extent. But again, this is not something that we will see in every single individual. It's a very individualized thing, depending on the personality, depending on any other comorbid conditions, depending on the socio-occupational statuses, any other variables that are there. So many variables that are there. But generally speaking, this is what we have seen. But in certain cases, it might be the other way around as well, where people, after the initial detox is done, that's when they start having cravings. That's when they start having a lot of irritability. That's when they start wanting to go out. There's emotional dysregulation. So depending from person to person, depending from personality to personality, it tends to vary. But generally speaking, early on, we've seen them having a little bit of, before they make that decision. And then once they get discharged, there's some level of dysregulated emotions for a few days at least.
Right. Okay. Of course.
Yeah, Raj, I want to add something. Dr. Danish, last webinar we had on recovery capital. So I was just able to relate. Is there something you want to mention in terms of recovery capital? Because a lot of things like what patient is coming with also gets counted. So as you have said that this is very individualized, so the journey would be very, very different for each and everyone. So I was able to, since I'm not from this background, but somewhere I just connected the dots where we had last webinar about the recovery capital. So do you also actually follow that thing when a patient comes in? So at that time you note down all the points, like what are the strengths and recovery capital, the term which we use in for this.
If I have to be very honest with you, see, we have to do a complete evaluation of an individual. We have to understand it's a very individualized process. So there is no one shoe fit all policy here. If you have 10 people for alcohol, for example, and not all 10 of them would have the same reasons for consumption, not all of them would have the same pattern of consumption, frequency of consumption, and so will be the treatment. The treatment will not be the same for every single individual. Now, the initial part, which we find very interesting, is that we have to understand the individual before we start to formalize that therapeutic intervention for that individual, right? And you can't do that while the substance is in the body, while an individual has. So you have to wait for the detox. You have to make sure the substance leaves the body. And once that happens, the true personality of an individual starts to come out. And that's when we can actually understand where the issues are. What are the reasons for the consumption? Is it are there any other comorbid conditions associated with the person as well? But that will all happen once the detox is done. Before that, it becomes very hard. It becomes very murky. We're not very sure, so we have to make sure that we just focus on the biological needs of the individual initially, at least, right? And then we start to document. Then we start understanding. Then we start going forward from that point forward. Not the first time they enter, the first day they enter.
Okay, that's interesting. All right, Dr. Niharika, would you like to add something?
Yeah, I'd like to add a few things to start off with. Yes, I do concur with Dr. Danish there that for a voluntary center like us, where we're doing everything as per the willingness of the individual, it's the initial part that tends to be the most difficult part emotionally that we tend to face with the kind of patients that approach us, as per experience. Because getting the person to acknowledge and accept that there is a problem to start off with, and getting them on board with the process is, I would say, the most important part of their emotional journey as per our experience. Of course, various centers, function differently. There would be, centers that work on an emergency basis, on an acute basis, where maybe, it's an absolute requirement to do the admission because we're looking at some element of psychosis or something more acute. But for us, it's the acceptance and acknowledgement, and that's when we generally have the patient going back and forth in terms of their acceptance and acknowledgement. There might be an element of denial to start off with, rationalization that we commonly see. They tend to sort of justify or minimize their addictive behaviors and overgeneralize. So these are the common things that we tend to deal with, and to get them on board with the process that, here, look, I think we need to intervene here because there is a problem that we're looking at, and having them to navigate that along with us is, I think, the most important and yet a difficult part for us. Of course, it fluctuates during the course, the emotional journey, the emotional landscape. If it fluctuates during the course of the stay and the treatment. There are times when there are mood fluctuations, more commonly seen during the course of their stay. A recommended time by any rehabilitation center is a 90-day program if we are targeting relapse prevention. So somewhere in between, we tend to see a varied landscape of emotions. But yes, following that, I think it also hugely depends on the team. What sort of team is backing you when it comes to post discharge recovery time? If you're looking at dealing with the pink cloud, or dealing with expectations, disappointments, um, lapses, even dealing with the pause or the post-acute withdrawal syndrome that Dr. Danish mentioned. It depends how in touch is your team with the patient. If we are part of the process, part of the journey as much as is possible with the patient along with the family members, I think it becomes an easier process. So we tend to have it going easy once we have the person on board. So for a center like ours, I think it's the first step that's the most important and difficult at the same time.
Okay, all right. So what I understand is that the experience is very subjective. Like, it could depend on the person, what the person is going through, a lot of other external factors like support, external support, or support from the team. But it does seem like, if I were to generalize completely, it reminds me of Newton's first law of motion, how an object in motion stays in motion, and an object at rest stays at rest unless an external force is applied. So when a person, yeah, to be able to acknowledge that and to change that direction and go into recovery is where you need the most amount of motivation, support, and power. And once you're in that journey, once it starts, it goes much more smoothly.
Absolutely. Absolutely.
Okay. So let's go to our next question. So we all know that with addiction, often a lot of other disorders might co-occur, like a lot of mental illnesses, anxiety, or other psychiatric disorders as well. So are these common, first of all? And if they are, do these disorders, the combination of these, does it make it much more difficult for people to go for recovery?
Um, you have to, this is a very interesting question. In fact, it's one of the most important questions as far as we're concerned. You have to understand that we don't know what drives what. Is it the substance abuse that leads to any other comorbid conditions like pathological anxiety or depression, or is it the anxiety and depression that leads an individual to having substance abuse, right? So that becomes a very important factor. Now, in our experience, what we have seen is a lot of people who have complained of, say, for example, depression when they come in, while they have substance abuse, while they have alcohol dependence or any other dependence for that matter. When the detox is done, once the medications and everything leave the body and the substance leaves the body, oftentimes we have realized that it alleviates by itself. Comorbid conditions are not there. There's no true depression that's there, or the anxiety starts to come down a lot more. So it also is very important because then it's substance induced. It's substance induced anxiety or it's substance induced depression. In some cases, it does not go away, and we can see that there's a clear comorbid condition that's associated with that. And this differentiation is so important for us because if we start to take everything and we go like, okay, there has to be a depression, there has to be comorbid anxiety associated with the substance abuse, then we're somewhere making the things unclear for us so far as the treatment is concerned. So when that demarcation happens, we're much more we can see it much clearly. We can then see that, okay, if there is any other comorbid conditions, then we can treat them differently, and why we are helping them get better. The emphasis in that case becomes more on the coping strategies. We have to make sure that they learn how to have better coping. So at the end of the day, when whatever they consume, whatever the addiction is, it's just a form of faulty coping, which leads to these maladaptive behaviors. And these maladaptive behaviors manifest in the form of their consumption, right? So the coping strategies have to be focused a lot more after that. But to suggest that are there any other comorbid conditions? Absolutely. But which comes first? Is it substance induced, or these comorbid conditions are inducing substance abuse? That differentiation is very important for us to make before we initiate any kind of treatment.
Okay, all right. Dr. Niharika, would you like to add?
Yes, Rajnandini. This is a really important question, especially for us, because Sanctum Wellness and Healing is actually a dual diagnosis center. So this being the most important of all of the questions, when we're talking about any type of addiction, I would like to add here that we're equipped to be dealing with anything that is co-occurring or contributory or independently occurring along with the addictive behavior. So a lot of times, yes, we do look at co-occurring disorders along with the addictive disorders, and they do cloud up the picture. They make it a lot more murky and vague for us to begin with. And which is why, just like Dr. Danish mentioned, detox is extremely important. We need to ensure that the substance is completely out of the body, and we're looking at a period where the physiological functioning of the individual has been regained significantly, and then with proper evaluation and assessment, we look at if there is any co-occurring symptoms of depression, anxiety, personality disorder, anything else that we're looking at. And is it independent of the addiction, or is it induced by the addiction? That is something that we figure out during the course of the journey. But it is hugely and commonly found. So then we deal with both aspects, and it's extremely important to deal with whatever sort of came first, and it's the underlying root cause of the symptomatology that we're dealing with. So if we don't sort of deal with the root cause, then we're just sort of pruning here, and we're looking at reoccurrence of the symptomatology in the future. So we've not done justice when it comes to the treatment. So being a dual diagnosis center, it's a huge part of our protocol to distinguish if there is any co-occurring or independent disorder, and most commonly being of course anxiety disorder, depressive disorders. We do have a lot of misdiagnosed BPADs, unfortunately, which might be induced by stimulants that people are hooked onto or addicted to, and that's why the manic episodes in the past. So, which is not your true bipolarity, but it could be substance induced, and of course personality disorders. Even the type of substance that we're looking at speaks volumes in terms of the underlying personality that we're looking at. What is the choice of the substance that the person has? But yeah, just want to take an opportunity to mention here that, of course, when we're looking at addictive behaviors and dependence syndromes, where we're talking about mostly substance dependence. But yes, of course, it's very common now, for rehabilitation centers, including ours, that we also cover, behavioral addictions and process addictions side by side, and of course they have co-occurring disorders as well. So that's another point that I'd like to just mention, that though we're leaning towards substances, of course, process addictions are also something that are very commonly dealt with.
Okay,
Yeah.
all right. So it seems like the individual's experience as well as the treatment depends a lot on what the co-occurring disorders are and which started what, right? To understand that and then tailor treatment accordingly works the best. So like
Raj, I would like to add over here. It was very interesting to know actually, because it is in the beginning itself, it is very difficult to firstly acknowledge, as Dr. Danish and Dr. Niharika mentioned. And also when a patient who is going through addiction and also through the co-occurring illnesses, psychiatric illnesses, I mean, acknowledging whether they have got depression, anxiety, and similarly addiction issues. So firstly, making themselves understand and acknowledge, and then visiting the doctor and opening about it would be very, very difficult. And as they have mentioned, totally detoxing the patient and then understanding like what came first and what is associated would really be very difficult. I mean, I was just thinking from the patient's perspective, like firstly making them understand about the problem, and then making the doctor psychiatrist understand, and also going through the process, how challenging it must be.
Absolutely.
So I guess that's why it has to be tailored to every individual patient's history. And all right, so now, you also mentioned how addiction is also faulty coping. So that was my next question. Like, how do people usually navigate these emotional challenges? What are the common ways that people go to when they're, experiencing emotional challenges? And are these practices usually healthy?
I mean, if you're talking about people at large, not everyone gets addicted, right? So it's not fair for us to say that everyone uses some level of faulty coping. Certain copings are somewhat socially acceptable, but might still be as faulty as other people consuming substance to deal with that. Uh, but oftentimes, again, I've got to say this again, that it depends on the personality. It depends on the temperament. There are a lot of variables at play. Um, Trauma for one person growing up might be not as significant for another person. The same incident, same situation might be traumatic for one individual, might not be traumatic for the other individual. So there's a lot of variables there. There's a genetic factor, there's a component there. So temperament plays a huge role here as well. And also that the reason why I'm talking about this is because it gives us a window about coping. So coping becomes very important, and a lot of the times, if the stressors are a lot for whatever reason, people tend to consume some of these substances because these situations, these triggers, these stressors will then induce an emotional state, especially a heightened emotional state. Most of the times, you'll see heightened anxiety, you will see other irritability, agitation, anger if things are not going according to what they thought they should, which then leads to this faulty coping, which means that they would start consuming something because they want to avoid. There's avoidance, they don't want to deal with any of those things, so they end up consuming substance, which is a maladaptive behavior. And then the substance, over a period of time, the nature of the substance takes over, and then you before you know it, you're addicted to that. Even after that time, tend to rationalize it, but sometimes they might not be able to do it, and that's when we come in, we can help them out with that.
Okay. Dr. Niharika, would you like to add anything?
So one way of one sort of litmus test that comes to mind, which can simplify the process for us, is of course, all of us tend to use some sort of coping strategy or the other. Life today, as it exists for all of us, and the circumstances that we have in the society that we live in, we have to deal with a lot of stressors on a daily basis. And to be able to deal with that, we need to have our own set of coping mechanisms that help us navigate life as it is. But one way of differentiating if this is healthy coping or unhealthy coping, adaptive or maladaptive, is basically to look into the consequences of our coping methods. Are we looking at short-term gains in terms of consequences, or are we looking at long-term consequences? So if something might be extremely, gratifying on a short-term space, uh, might not be so great on a long-term basis. So that in itself, tends to catch up with us over the course of time. So that is a temporary crutch that we're using for now. And addictive substances, tends to fall in that category. It might help us get a sense of relief. It might help us deal and navigate with our current stressor. But what is the cost to that on a long-term basis? So that's the demarcation between whatever it is that I'm doing to deal with my stressor right now, is it adaptive or maladaptive? And addiction, of course, is maladaptive, and because one tends to develop tolerance, and there are a lot of other ailments and negative consequences over the course of time that we have to then deal with. And coping strategies is a huge component of what we try to, healthy coping strategies is what we try to then incorporate for the patients during the course of their stay, and it's critical for the therapy process. Yeah, treatment it would be far from complete without implementing healthy coping strategies in place for the patients.
I think that's a very helpful tip to be able to differentiate between whether you're using to get away from stress is a short-term gain or a long-term gain and the consequences of that. But can you explain that with maybe a few examples just to understand that better?
Right. So the most obvious example that comes to me is the most common type of addiction that we tend to come across, that being alcohol, right? So let's say an individual is anxiety prone as a personality already, and is obviously going through certain a phase in their life where they have to deal with uh, triggers, stressors, which cause them to feel more anxious in the moment. Now, for a lot of people, they tend to deal with their anxiety by consuming alcohol. Alcohol, because it immediately brings down the anxiety levels. It's anxiolytic, in its nature. So the immediate benefit of consuming alcohol makes one feel relaxed. It's great for unwinding. And if somebody tends to then use that more regularly over and above any other type of coping to deal with their anxiety there and then, to basically navigate their daily life stressors, then that's the wrong crutch to be using. That over the course of time becomes maladaptive because of the very nature of alcohol. It being addictive, what might have initially given relief is required to be increased in quantity over the course of time. And before you know it, alcohol is controlling one's life, and alcohol is causing the rebound anxiety to take place further, when the effect wears off. So the long-term consequences are a lot more damaging in comparison, even though one might initiate the consumption with short-term gains. So yeah, that's the most common example that comes to mind. And a lot of time people, when they're talking about the history or the family members are talking about the history, they always start off that way, that initially it was just a little, it was recreational. It would even help with my performance, doctor. It would help me unwind on the weekends, and I would perform great from Monday to Friday. But I don't know, just last 1 year, it's happened to an extent where I don't feel so great on Mondays. I do think that I'm feeling jittery on Monday mornings. So there's a cost that we're paying for using that alcohol for our short-term gains. And it's gradually taking us that much closer to getting dependent on it to be able to navigate and manage life. So, yeah.
Okay. So what usually starts as a solution, like an immediate solution, actually becomes a much bigger problem. And I
If I may add here, I mean, it's self-medication. They start off as self-medication. If I give an anecdotal example of one of our clients, one of our patients who was very nervous when he would go and have to present something in front of a board meeting or something, and he realized that he would just have a drink and then go and present very well. He would have confidence to do everything. He felt really good. But over a period of time, while he was doing that, and initially it did really help him, then gradually over a period of time, he ended up becoming so drunk that the same alcohol which was helping him initially now started to hinder his progress. And everyone at work started to recognize that those meetings didn't go as well as they would have in the past. So what started off in a very short-term gain with a short-term gain then created a lot more problem for him in the long term.
Okay. So now since we're talking about emotions, do emotions have a role in pushing someone to start using substances, or if they've already recovered from addiction, to get into a relapse?
Yes, absolutely. If an individual does not recognize the emotions, if they're not able to recognize what emotions they're feeling, and they're not able to cope with a heightened emotional state in a more healthier way, then the chances of them going back into addiction is pretty high. If an individual doesn't know how to deal with a heightened emotional state of anxiety or irritability or any of the other emotions that we have, then the chances of them falling back into addiction absolutely is pretty high. So the heart of the issue is that how do I cope? How do I deal with these emotions? And these emotions are brought about by the external factors. They don't exist in a vacuum. You're not going to have a heightened emotional state if you're sitting by yourself. There has to be a stimulant. There has to be a stimulus. There has to be a trigger that induces a heightened emotional state. And if you don't know how to deal with that, how to cope with that, then the chance of you going back and having a maladaptive behavior is pretty high.
Okay. Dr. Niharika, would you like to add anything?
Yes, absolutely. I agree there. It's a huge part of the relapse process. Of course, scientific research and a lot of people have worked on relapse as a process. And when it comes to, Gorski, there are multiple steps to a relapse. But to simplify the process, I'd say broadly, we can say there are three parts to a relapse. So when we're looking at a relapse, it's not an event, it's basically a process. So starting out with the emotional relapse, the mental relapse, and then the physical relapse. So relapse in itself starts off as an emotional process. So whenever we observe somebody in the recovery, while they're undergoing their recovery, let's say post-discharge, and they're having emotional disturbances. They're having mood fluctuations. There is easy irritability, that tends to be triggered by small events, which is disproportionate to, let's say, the circumstance that, one might have been in. Then we're looking at the beginning of an emotional relapse. That's a potential red flag for, anybody as a part of the professional team to look out for. A lot of times cravings manifest as emotional disturbances. So one might respond disproportionately to a circumstance, but it could actually be an underlying craving to the substance that's manifesting in the form of the heightened emotional state. So to have a lookout for that is extremely important, because that's what's having a domino effect and eventually could lead to an actual literal physical relapse. So as professionals, we need to look out for that, and we need to stop it there, sort of nip it in the bud before it progresses any further.
Okay. So when people are going through these emotional difficulties, it's very common. Like the first thing that people think of is to reach out to a friend or talk to someone, get like social support. So could you tell us some ways in which people usually try to help their loved ones, but the way that they help them might not be very healthy, or might actually be counterproductive for them. So instead of helping them, they might be harming them. Are there things like that that people tend to do, and what are these?
Yeah. So you got to understand, a lot of the times people think that when an individual who is, say, for example, craving, or he's going through some level of emotional relapse, as Dr. Niharika just mentioned, which is just a process, right? So that is that an individual is experiencing a lot of dysregulated emotions. And once that individual goes to a friend or a family member, the common tendency for people, for the family members, is to try and rationalize, understand the problem, and use a logical response to that. The issue is that it tends to frustrate the family members when they think that, oh, I thought we had it. I thought he understood when we explained it. And now all of a sudden he's still doing the same thing. I don't understand why. They will say it once, they'll say it twice, maybe they'll explain it three times. But after a point in time, they start getting angry, they start getting irritated as well. Point is that they don't recognize what exactly is going on. They are approaching the same thing from a very rational standpoint. They see a problem, they see their loved one coming to them with a problem, and their natural instinct, rightly so, is to try and resolve it, try and find a solution, right? So you're approaching an emotional problem with a more rational cognitive approach. Now, as well as it is, it tends to frustrate the family members itself, because they undergo a lot of emotional dysregulation after a point, because they feel that, okay, he's not understanding, or he does understand, because understanding was never a problem. They would always understand. It's not that. It's how do I deal with it? What are these emotions? Why am I feeling this way? Why do I get angry? Why am I so anxious? Why am I so sad? What is happening in that sense, right? So I think this is it's very important that they find help from the right people. Maybe a professional. One of the best things that we think we do here is to make sure we tell people that after discharge, it doesn't matter what time of the day, it doesn't matter what time of night. If you feel that you are feeling, you're craving, or you're having any kind of urges, and you're not able to understand, just give us a call. We have a proper helpline for them 24/7 that we can be approached at any point in time, so that then we can talk certain things through. And oftentimes it just lasts a few minutes. And if they can ride that wave, oftentimes it settles down and they are able to carry on forward. But it's very important to understand who to talk to. A programs have those sponsors that oftentimes do that job for them, where an AA sponsor would then be able to do that for them. But so this is something that we've seen happen, the family members getting a little frustrated, a little irritated, because they feel that they're trying to help, but he's not willing, or he or she is not willing to accept that help.
Right. So the family members are also coming from a good intention, because
Absolutely.
someone's going through something, their loved one, and they want to do anything to help them. And the best way is whatever knowledge they have, they're trying to give them solution. And if it doesn't work, of course, it's frustrating, and it just ends up making the situation worse. So
Yeah, here I would like to add, maybe because firstly accepting, then the last resort, anyone thinks like going to the psychiatrist and going through the whole process, and then the family members might be having the hope, since we have taken the patient over there, so now the total solution is here. So in the whole process and journey, I think the patient's testing of the patient along with the loved ones also takes lots of ups and downs, and as Dr. Danish has rightly mentioned, so that is where like whole journey is like pretty difficult, and it is very recommendable what he mentioned, that 24/7 support is there from Sanctum. So that's the wonderful thing, because usually after the working hours, if the patient needs help, where does the patient has to go? So that once again becomes the problem.
Absolutely.
yeah. Dr. Niharika, would you like to add anything?
Right. So while Dr. Danish covered the aspect of, let's say, recovery and post-discharge journey of the patient, I'd like to cover the aspect of, what it is prior to the admission. So when we're looking at, let's say, friends and loved ones and family members, though of course they all have the best of intentions at heart, but they might end up having counterproductive effects if they are a part of certain types of behaviors, which we have certain technical terminology for. So there is enabling that one might be guilty of. So as family members or friends, we can enable somebody's addictive behavior without even realizing that we're doing that. And sometimes there are relationships where people are stuck in codependency patterns with their partner. And that in itself can also stall the process of an intervention and doing something professionally in terms of helping the patient. So to simplify this, I'd like to give an example. What tends to happen is, for a lot of families, again, alcohol comes from mind because it's the most commonly seen and discussed and experienced. So it's the most common example that's coming to my mind. Let's say somebody is consuming a lot of alcohol as per family members, so they think that this is excessive consumption, and maybe we can help by reducing the amount that the person is going to consume. So by doing that, once the person has already reached addiction, and let's say is facing certain amount of withdrawal symptoms in the morning, they've consumed a significant amount at the night, during the night before, And in the morning, they tend to have certain amount of withdrawal symptoms where there's some amount of tremulousness, some amount of nervousness, restlessness, anxiety in the body. And a friend or a loved one sees that and witnesses that, they're likely to help that by saying, okay, you seem really uncomfortable today. Maybe you can have a little bit to reduce the symptoms that you're having right now. So I think that is counterproductive. We're enabling an addictive behavior without even realizing it. A lot of times, the partner and the um, addict or the patient, I wouldn't want to use the word addiction or addict, pretty common because there's a level of stigma associated with it. But let's say the patient and the patient's partner, they are codependent on one another, and the substance dependence is a part of it. So without realizing it, they're stuck in a certain pattern, and they are not reaching out for help. That also becomes counterproductive because we're allowing the addiction or the dependence to fester. We're allowing it to grow. We're allowing the treatment or the intervention to be stalled. And in such scenarios, what I would recommend is uh, two things. One is the World Health Organization, that is the WHO, has a diagnostic criteria when it comes to dependence or addiction. So if one can read that, it's commonly found everywhere. I would just request, read the diagnosis, the criteria for the diagnosis of addiction or dependence. There are 6 diagnostic criteria. If you have 3 or more of them, I would say it's time for an intervention. And this is something that's applicable the world over. So this is the same in Canada, America, Europe, India, every country of the world, applicable to all of us humans. And secondly, if that is the case, reach out for professional help. Leave it to the professionals, because sometimes we might be, doing it wrong, even if, of course, we have the best intentions, but in the process, if we are stalling treatment, then we're allowing the addiction to grow. So that would be, my suggestion.
Wonderful example, Dr. Niharika. I mean, you have really taken us through a beautiful example. How little this step would be, but how it hinders the actual process. So wonderful.
Thank you. Yeah, but it's such common experience. We see this day in and day out, and we understand that they're doing their best. But
Yeah.
these are the steps I would recommend for
Yeah,
anybody.
as you rightly mentioned, like, I mean, the person around might be having the best of the intentions, but actually they are not helping. They are actually taking them steps behind.
Yeah.
Right.
If I may add here, I think the true rehabilitation involves family. Family therapy, any rehabilitation without family therapy is absolutely incomplete. While the patient goes through his own recovery, he goes through his own therapeutic interventions, the family also requires to go through their own, therapeutic interventions. Very important for them to understand the nature of the illness. Why exactly is it happening? Why does he behave this way? Why does he think a certain way? Why does he feel these things? It's very important for them to be able to process their emotions as well. So family therapy is extremely, extremely important. Any rehabilitation without family therapy is absolutely incomplete.
So, Dr. Danish, you might be taking up the family rehabilitation also part of the patient
Absolutely.
rehabilitation.
Absolutely. Without that, it's 50% of the work, less than that, I would say. Because at the end of the day, they leave the facility and they have to go back to the same environment. And if the
Yes.
environment is the same, and if there's nothing there, then the chances of them relapsing is pretty high. So it becomes it's imperative that the family undergoes therapeutic interventions while the patient also has its own journey. The family also tends to have its own journey, or has to have its own journey.
Right. Right.
Okay. So while we're speaking about how people tend to help other people, usually we see that the common advice given around is think positively or be happy, like why be sad, you shouldn't be angry, things like that. So should that be the goal for someone who is going through addiction and recovery?
It's very easy to say to someone, be happy. But you gotta, it's not that, it's easy to say stuff. As I said, the families will try the best. They want the best for the person. And for them, it's very hard for them to understand why. See, it's very hard for a lot of people to understand why can't he stop? You know, I mean, fine, I get it. He can have one drink. I know so many people who drink, but they stop after having a drink. Why doesn't he stop after having a drink? They can't wrap their heads around a lot of those behaviors. They can't wrap their head around the fact that why is he sad? He has everything going for him most of the times. Everything is fine. So it's very easy for them. That's why I said that, as well intended as they are and as much they want to help the person, it's very hard for them to truly be able to do it unless in certain cases who have gone through a lot of their own therapeutic intervention, they're able to help a lot better. But I think it's very important for the family members to also go through therapy.
Okay, all right. Dr. Niharika, would you like to add anything?
Yes, though of course, be positive, be happy. These are great mantras, that do the rounds, and they're great to start off with. But I would say they're just the tip of the iceberg. Every human being, every individual, we have different emotions. There's a whole range of emotions that we all tend to have. And of course, a person in recovery would have just as many emotions and different emotions and feelings like any other individual. So if something is making you angry, that's okay. It's okay to feel anger. It's okay to feel disappointment. It's okay to feel sad. If there is a trigger for it, there is an event that's causing you to feel that way. But at the end of the day, I would say everything lies on a spectrum or a gradient. So if the anger is not well managed or regulated and it's becoming excessive, then we need to do something about it. If the sadness is leading for us to be depressed eventually, it's crossing a line in the sand where it's leaning towards, let's say, a disorder and depression. We need to do something about it. We cannot enforce ourselves to be happy at all times. It's just not possible. So we're all going to experience all sorts of emotions, but yes, it's important to understand that where are we on that gradient? Is it something that we're regulating and managing successfully, or it's something that is to our detriment and to the detriment of people around us? And if we're confused, I would say just reach out to a professional and more than be happy in recovery. I would just like to tweak it a little bit and say be in touch. Be in touch in recovery. Be in touch with your team members, the professionals, the people who were there for you during the course of your treatment, because they know you really well. They would have spent hours and hours of treatment, therapy, all of that with you for months. And if you're in touch with them, they should have a good idea of figuring out what is it that we're looking at. Is this excessive? Is this okay? Does this require intervention? All of those things. And one thing I'd like to add that, of course, it's important for your team to be passionate also about, your recovery. That there are no shortcuts for treatment. So if the team members are doing adequate justice when it comes to the individual therapy, the group therapy, the family therapy, it's a holistic process where everything is being worked upon. I think then there is no substitute for that. I think that's what's actually required, because recovery is something that we're aiming for as a lifelong, commitment. Yeah.
Okay, so it seems like emotions in themselves aren't necessarily unhealthy, but the way we cope with them can make it unhealthy. So this is my last question. Can you share some like simple coping techniques that people can use when they're going through these emotional struggles?
I mean, before I say anything, there's this notion that we have that there are positive emotions and then there are negative emotions. In reality, there is no such thing. I ask this question a lot to a lot of my patients, and I'm like, if we have, hypothetically, if we had a magic pill that if I give you, you'd be happy all the time, would you want to take it? Or what should I be giving it to you in the first place? Or even if I can, what should you take it? The point is that you will never know what happiness is if you don't know what sadness is. They're all absolutely, absolutely important. Every single emotion, there is no negative emotion. They serve a purpose. Anxiety serves a purpose. It tells us that, you have to prepare for something. Sadness serves a purpose. Anger serves an extremely important. Every single emotion serves a purpose. So the idea is not to seek out the positive, so-called positive emotions. The idea is to be able to regulate each and every emotion properly. And before you are able to regulate these emotions, you have to be able to identify them. And for you to identify them, you have to understand that um, how is it, how do you understand that? Is by understanding your body physiologically, because your anxiety is going to have physiological symptoms. You're going to have physiological manifestations. You're going to have some level of tremors, some level of, maybe a little restlessness. So if you're able to figure out that, if you're able to be in touch with your physiological, biological self, you'll be able to identify your emotions a lot better. Once you identify them, you'll be able to then regulate them much better. So again, if you ask me to have certain tips about coping with these emotions, there are no simple ways. You have to go through an extensive therapeutic intervention. You start with recognizing your emotions. Once you start recognizing them, then you start regulating them better, and then you're able to deal with them and cope with them in a much better way.
Okay, so it's important to have a healthy relationship with your emotions itself, where you're okay with your emotions being there and not selectively choosing, no, I just want to be happy. And I think you put it really well, how if you were just to be happy all the time and not feel any other emotion ever, then happiness would basically not mean anything. It would just be the normal state of being. So that's very interesting. Dr. Niharika, would you have anything to add?
Yeah. So with regard to the coping, yes, I agree with Dr. Danish that therapy, of course, has a huge component when it comes to, coping strategies. So there are a lot of nuances, involved. Uh, to summarize it and put it across, becomes a little difficult. But the topmost thing that comes to my mind is, in any scenario, um, take a pause, you know, just try and observe and evaluate what is it that we're going through right now. Just like doctor mentioned, that what is my body going through right now physiologically? What is the emotion I'm going through right now? How am I feeling? So that little pause there before impulsively reacting goes a long way. We then end up doing, once we've paused and we've given adequate thought as to this is what we're going through and this is what my response needs to be, then we're likely to respond in a manner which is not going to lead to regrets later. Um, so responding after thinking and giving a certain amount of time is one of the best coping strategies that I can think of, which summarizes a lot of things. Um, but yes, that's a bit of a shortcut. I would say it's important to reach out to a therapist and to go through the exercise of discovering yourself, your unique personality, your early life events, what makes you think the way that you think, feel the way that you feel, and behave the way that you do. Once you understand yourself better and your patterns, then you would be more equipped to put in the right coping strategies wherever required. So, yeah, that's that.
That sounds like a very simple tip to take a pause, but I know in the moment that's also difficult to do. But it's a very short and sweet advice that people can easily remember. So thank you so much for answering all of my questions, and this was extremely informative and interesting conversation to have. We have one questions from the audience on Facebook, so I'm just going to quickly take that up, and then we can wrap up. So the question is, how can I emotionally support my husband who just got back from rehab?
Hmm, 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 hmm.
Very,
Uh,
very,
yeah,
yeah,
Dr.
doctor.
Danish, please.
Yeah. I think it's a very important question. How do I emotionally support my husband who has just gone back? This is a very important question that we get asked a lot as well. Oftentimes, family members go like, "How do I do? How do I deal with it?" And the last thing an individual should not do, is walk on eggshells around that individual. So oftentimes people are very careful about what they say so that they don't, upset the individual. They don't do any of those things. And if they're walking on eggshells around them, then it becomes a problem going forward. The idea is that while he has gone through therapeutic intervention, while he was in the rehabilitation, he has gone through a proper rehabilitation process, then the emphasis of coping should be much more properly brought up with him. And the best way for her, for the family member to deal with it, is by going through their own, going on with their own therapy. They have to, because they need to understand, they need to be able to regulate their emotions. The last thing they need to do is to walk on eggshells around them. Be very careful about what they have to say. Be very mindful of everything, every little thing initially, because that never lasts, and it always leads to the end, and it always is a problem going forward. So that's one advice that I give all the people, that while the patient has gone through therapy, you should also go through your own journey of therapy so that you heal yourself. Because caretaker burnout is a very real thing. People who live with people who have addiction are absolutely going through a lot themselves. So they need to process that as well. The better they get, the better, the better mental health they are in, the better they're going to be able to support their loved ones. So for her, I really recommend that she should go through her therapeutic interventions and not worry about, what do I say? How do I say things to him? Because that might not be the right approach.
Okay. Is there anything that you would like to add, Dr. Niharika?
Yeah, Rajnandini. What I'd like to add is I do agree. That's a very important point, that it's important for the family member to take care of their own emotional health and their mental health. If they are not doing that, then they wouldn't be able to adequately support, the person in recovery while they're, going through the recovery process post discharge. Um, but more importantly, yes, we encourage them to not walk on eggshells around the person. Um, a lot of times there is a tendency that I need to say the right thing. I shouldn't trigger the individual. I feel guilty if after what I've said, the person goes ahead and relapses. I'm going to be blamed for not having taken adequate care post discharge, and this has led to the relapse. So these are common fears, worries that, the family member would have. But we'd like to say one thing, that the person above 18 years of age, having gotten discharged from a rehab center, is an adult. If the rehab has done justice to the treatment, then would have equipped the individual to deal with their recovery, their stresses and triggers. And of course, we're there to be in touch with and to help out during that process. But no matter what situation, event, crisis, stressor happens, as an adult, we have the choice of choosing the substance or the addictive behavior over and above any other behavior that we might choose. So there are a zillion ways that we can respond to a situation. The choice is up to the adult. So it might be easy to blame, it might be easy to provoke guilt in our family members, but at the end of the day, once the treatment is done and the person is discharged, it is the individual's choice to go ahead and pick up that bottle, no matter what the circumstances are. So I don't want family members feeling guilty or blaming themselves for that relapse. And we're here for the treatment, we're here for the follow-up. And if done correctly, the family should know that in no way should they be held responsible wholly and solely for somebody's recovery. That's not possible, and that's not right.
That's
So,
not
yeah.
fair. It's not
Yeah.
fair for the family to be to think that, okay, we are now, personal responsibility is extremely important, and if therapy is done right, I think people would recognize that this is my responsibility, and I need to take responsibility for my actions. And while the family members also go through their own, journey, um, in their journey in healing, I think that would go a long way.
Yeah, that's a wonderful response. Thank you so much. Now, I think we're good to wrap up. So over to you, Bhavna.
Yeah, that is what I was just saying. Like, we are just on time. I mean, by the time we just finished our questions, it was complete 6 p.m. and we were able to take up the question. So it happens very rarely, like either we are early or we are away from our time. So thank you so much. It was really informative and insightful session, Dr. Danish and Dr. Niharika. And I'm sure it will help a lot of people in our network. And before we wind up, I mean, any ending note with which you want to leave our audience with, Dr. Danish and Dr. Niharika?
Since we're talking about emotions, and I think I already mentioned it once, that there are no good and bad emotions. Every single thing nature has given us for a purpose. You have to understand that they're all your friends. Every single emotion is there to serve a purpose in your life. You have to just learn how to listen. Be a good CEO of your own mind. So these emotions are your employees, and they have to listen to you. You let them deal with things and situations by themselves, and you're not at the helm of it, then it's going to be a problem for you. But if you take charge, but you listen to every single emotion, understand what the emotions are trying to tell you, you will be able to deal with life's situations. It doesn't matter what life throws at you.
Dr. Niharika?
Nothing to add to that. I think that's really well put, and that pretty much sums it up. And that could be the highlight of our webinar today. And I'd like to thank both of you, Rajnandini and Bhawana, for letting us have this opportunity. And it's been lovely, and I thoroughly enjoyed it. Thank you.
Thank you so much.
Thanks.
It's wonderful.
Thanks, Dr. Danish. And your ending note is actually very apt. Learn to respond, not to react actually to your emotions, what I could actually decipher from that. Because you are the own CEO of your mind and you have to act accordingly. So it was really great having you both today. And thank you so much to you and to our participants. We will be back soon with another webinar in some time. Till then, stay healthy, stay safe, and be the CEO of your mind.
Thank you so much. Thank you. Thank you.
Thank you.
Thank you. Bye.
Thank
Take
you.
care.
Bye-bye.